Hello and welcome to HLTHPS007 Administer and Monitor Medications. The acknowledgement of country. In the spirit of reconciliation, Meditech training acknowledges the traditional custodians of the country throughout Australia and their connection to land, sea, and community. We pay our respects to the elders past, present, and emerging and extend that respect to all Aboriginal and Torres Strait Islanders today. The objectives for this presentation includes two elements, and the two elements are identify and prepare the client for administration of medication and also administer medications within the legal parameters. And this the performance criteria will be discussed in more details in the presentation. Okay, greet the client and also prepare the medication for administration. The client is likely to adhere to medication since they're less afraid. Each time you meet a client, it's very, very important to be respectful and to build a relationship with them, professional relationship with them, obviously. And here are some steps to engage with the clients when greeting them. You need to greet someone in a warm and friendly manner. You need to introduce yourself, even though this is not your first time meeting them. You need to identify the client. You need to know the client's preference. You need to also put on your badge to make it easier for the client to remember your name and to be able to notify you of any issues related to medication in this case. You need to seek consent and discuss the medication administration procedure with the client, and you need to encourage client participation. How to prepare the client. You need to adjust the client's posture and position. So you need to sit the client in a 90 or 45-degree, depending on what suits the client, making sure that there's no risk of them choking or aspirating on the medication. And when I mean aspirating on the medication, mean that something like a liquid medication is taken, you don't want a situation where it goes into the wrong pipe, which is the breathing pipe instead of, you know, the food pipe. So being very careful with that. Seek assistance from other staff. So for when you're administering medications such as rectal and vaginal medication, it's very important for you to have another staff in order for the staff to help you roll the clients to the side and for you to be able to administer the medication correctly and effectively. Provide privacy. Client privacy is mandated by law, and it's important to make sure that the privacy and confidentiality is maintained and their information, medication information, is not accessed by unauthorized personnel. Expose the clients to the treatment room area. So also putting them in doing giving medication in a treatment room is important, and also a way of providing privacy and confidentiality, and also maintaining the client's integrity. What things you need to do is you must orient the client about where you're going or why you're doing what you're doing in that room or in the treatment room, which obviously will be medication administration. Check the client's medication. A few things you need to do when checking a client's medication. You need to make sure that the medication is free from contamination. So making sure you check the packaging, making sure you check if the lid was closed properly. Routine check should be done, and also dispose of any contaminated medication properly. Second one is checking if the medication time and client correlates with the documentation. So making sure the frequency and the time of the dosage are accurate, which is very important. You need to check the expiry date. Expiration date is always abbreviated in EXP. I'm just knowing that the last day that the medication is safe and effective to be given, or safe to be given. The fourth one is checking the dose of administration aid for evidence of tampering. So making sure or checking if the blister pack has tears or holes, if there's an improper amount of medication in the box or in a container, reporting missing medications, and also looking for general signs such as discoloration, damaged medications, or even strange colors. As you check the medications, it's important for you to abide by the organizational guidelines and also the delegation from the health professional. Accurately explain the administration procedure to the client. Explaining procedure will give the client opportunities to make informed consent. Consent is informed when the client is given accurate information about their treatment. There are ways on how you can do this. You need to be familiar with the administration procedure. You need to inform the client about the medication purpose, dose, and side effects. You need to take note of any communication barriers between yourself and clients. You need to refrain from jargons and technical language. You need to give all necessary details and you need to ensure that the client understands the procedure. Check the client for any physical or behavioral changes. Another way to prepare the client for medication is to check for any changes you may need to report. This indicates that you need to halt or postpone the medication. It's essential that you do this since the indicators are signals that the client is not ready for medication. Examples of what to look for. You need to look for changes to the airways, slow, fast, or absent of breathing. You need to look for inflammation, rashes, swelling, headache, skin tones, feeling of dizziness, complaint of pain, confusion, changes in behavior in ECT. To find out who the prescriber is, you may refer to the following documents, which include the care plan, the medication charts, delegation instructions, and the organization chart. When to report. You need to update the delegating health practitioner or professional regularly about the client's condition and how to report. The steps of doing this is similar to reporting risk. The following are steps to report physical and behavioral changes. You need to make sure you record the client's information related to to you need to report you need to make sure you record the correct information related to the client's physical or behavioral changes. You need to prepare the recorded information on physical and or behavioral changes before the client's next dose. You need to identify the delegating health professional you need to report to. You need to set a meeting with that delegating health professional. Accurately, accurately relay information to the delegating health professional. Make sure you understand the delegating health professional's instructions for you and apply the delegating health professional's instruction on what next to do. Administer medication as delegated within role responsibility. You need to learn the procedure for handling and administering medication. This information is essential that the client so that the client can be medicated safely and effectively. Now we have the capsule. The capsule is a cylindrical medication that is either hard or soft or has a hard or soft shell. And this comprises of different things. So powder in the hard shells and oil in the soft shells. Now this can be given orally, um, pessary, or suppository. Um, tablets, and sorry, that just to specify it. So suppository is given through the anus and pessary or pessary is given through the vagina. Tablets is a powdered medications are molded and compressed into tablets, and this can be given orally, sublingual, buccal, pituitary, and suppository. Droplets are medication via a drop, so this can be given through the eyes, nose, and ears. Inhalants are given through the mouth, and these are inhalers. They are administered through the intake of air. We have liquid, which are solutions, mixtures, and syrup. These are given orally. We have lotions and creams, which lotion has low viscosity and the creams have high viscosity, and this can be given topical, which means skin, and also through the vagina and anus. We have ointments, which are topical, given through the eyes, given through suppositories and pessaries. We have patches, which are adhesive that are attached to the skin. This can be given topical. Powders, topical, and powders are just solid that comes in fine particles. Wafers, these are thin tablets that dissolve when in contact with saliva. And this can be given orally, sublingual, and vocal. You need to administer medication forms according to proper procedures. Following procedures is vital to prevent toxicity and poisoning, to achieve the medication's desired effects, to prevent harmful reactions, to prevent overdosing, and to prevent infections. Sublingual, oral, vocal medications, just making sure that you do not crush unless authorized by the delegating health practitioner or permitted by the delegating health practitioner. Making sure that the client is informed of the procedure. For wafers, just making sure that you don't remove the wafer from the pack unless you're ready to administer the medication, and also instruct the client not to swallow, but to leave it in the mouth until it dissolves. For oral medication, making sure that you shake the bottle only if the instruction specifies it, and using different cups in administering more than one medication. Before you give the medication, the oral, sublingual, and vocal medication, you need to make sure you wash your hands. You need to make sure that you pour the medication, if it's liquid, in a clean cup. If the client needs to swallow the medication, offer a drink of water or juice for the client to take the medication with. Make sure the medication is sitting or standing upright. If the client cannot sit, ensure that the bed is adjusted in a 45 to 90 degrees angle. Either administer the medication or instruct them to do so. For oral tablets or capsules, use a spoon and place the medication in the client's mouth and let them swallow it with water. And for sublingual tablet or wafer medication, place it under the tongue and let it dissolve completely. And the client should not chew or swallow the medication. All right. Administer medication or instruct them to do the following. For the vocal tablets or wafer medication, place the medication in your mouth against the inner cheek, so just at the side over here, and allow it to dissolve completely. For liquid medication, hand them the cup or the tumbler from where they will drink the medication. When using oral syringes, draw up the right dose in the syringe and ensure there are no air bubbles. Drop the liquid in their tongue or on their tongue, sorry, and not at the throat to prevent choking. Ocular, which is the administering in the eye, do not touch the tip of the dropper or ointment tube, since this will contaminate the medication, and do not let the droplet or ointment tube to touch the contaminated area. Before you do so, you need to wash your hand. You need to offer the client tissue or clean cloth to wipe their eyes in case of any excess drop. You need to cleanse the area of any fluid or debris. Sorry, you need to adjust the client's position. You need to instruct the client to look straight ahead or focus on a single object. If you're administering eye drops, you need to invert the eye drop container. You need to use the finger to expose the client's eyes so that you can put the eye drops in the eye. If you're doing an ointment, you need to apply the strip of the medication along the sac, moving from the inner to the outer. And you need to twist the tube to cut off the ointment strip. After releasing the eyelid, instruct the client to close their eyes and move their eyeballs for a few minutes. Tell them not to rub their eyes. If you're administering eye drops, apply a little pressure under the inner cancus for 30 minutes. So um, just to allow the medication to go into the eyes. When administering ear drops, do not touch the tip of the dropper, since this might contaminate the medication, and do not let the dropper touch the contaminated area. Again, hand hygiene, using warm water and warm cloth, clean the external ear, position the client lying on the side. For an adult client, pull the ear back, and for a child, pull the ear down. Position the dropper over the ear canal. Let the drops fall into the inner ear side or inner ears side. Yes. After releasing the ear, let the client remain in that position for about 5 minutes. Lightly massage the ear, so around the ear area over here, so that the medication can go into the ear and um, have the desired effect. Intranasal, so the nose, do not touch the tip of the dropper because you contaminate it, and do not let the dropper touch contaminated area. Once again, hand hygiene. Provide tissues and allow the client to blow their nose. Position the client in a lying down position or whichever position, or place a pillow on their head or their neck. Instruct the client to tilt their head back if they're sitting, and if the client has a spinal injury, do not tilt their head. Instruct the client to breathe in and out only through their mouth. Position the dropper over their ear canal. For nose drop, position the dropper 1 centimeters above nares. Allow the drop to fall. For nasal spray, instruct the client to hold down one nostril. Sorry, not one nostril. We have one nostril, and while they're doing so, they can breathe through the other nostril as the medication is being administered. Inhalant. Avoid touching the mouthpiece. Shake the inhaler before use, depending on instruction for use, and hold the inhaler in the right position. All right, administering the powder dry inhalers, remove the cap, instruct the client to inhale deeply and hold their breath for about 2 to 3 seconds. Dry powder inhalers can be activated by inhaling, unlike the metered dose inhalers. Uh, repeat the steps according to the number of doses instructed by the health professional. For metered dose inhalers, assemble the inhaler as per the manufacturer's instruction. Check if the inhaler canister is inserted in the holder. Remove the mouthpiece of the inhaler. Shake the canister. Position the client. They can either sit up or lie down at a 45-degree angle. All right, when administering inhaler, instruct the client to close their lips around the spacer mouth. The client may breathe regularly. You or the client can depress the canister to spray the medication into the spacer. Ask the client to inhale for 5 seconds and hold their breath for about 10 seconds. If the client has only one medication, repeat the process every 20 to 30 seconds between inhalation. If the client has 2 or more medications, the client can wait 2 to 5 minutes between inha in inhaling or inhale. How can I pronounce it? Inhalations. For inhalers without spacer, place the mouthpiece in the client's mouth. Instruct the clients to close their lips around the mouthpiece. Instruct the client to inhale and exhale. Instructs the clients to hold the inhaler properly. And the client must hold it between their thumb and their finger in this way, and later should be at the top. For inhaler without spacer, instruct the client to tilt their head back. Let them inhale while pressing the canister. Instruct the clients to hold their breath for 10 seconds. Remove the inhaler as they exhale. The client may gargle water for 2 minutes after using the inhaler. Nebulizer. Making sure it is assembled according to the manufacturer's instruction. Avoid touching the mouthpiece. Add medication to the nebulizer cup. Position the client. They either sit upright or lie down at a 45-degree angle. Ensure the mouthpiece or mask is secure. Turn on the nebulizer. Instruct the client to take deep breath. The client must hold their breath 2 to 3 seconds before exhaling. The method is to be done to maximize the medication effect. The client should be on nebulizer for about 8 to 10 minutes or when the medication runs out. Turn off the nebulizer, wash and dry and store the nebulizer pads, and the client should gargle water if the medication has steroids. Topical medication or transdermal. Do not touch the side of the patches with the medication. Lotions, creams, and ointments should be handled with gloves. The skin may absorb the medication through your hands and take effect on you. Um, Clean the affected area before applying any form of topical medication. Avoid overlapping patches if more than one is required to be applied, and do be careful not to accidentally inhale the powders. Wear gloves and perform hand hygiene for topical medications. If there is any old patch, remove it. Clean the area where the older patch was applied. Dispose of the older patch as the organization's disposal procedure. If possible, write the date, time, and initial on the patch. Apply the patch to the clean area and ensure the area is dry, hairless, and not irritated. Remove the patch backing without touching the medication and apply the patch for 10 seconds. Hold a hand over the patch and press around the edges. For creams, lotions, and ointment, wear gloves and perform hand hygiene. If the area of the skin is broken, use sterile gloves. Clean the area and make sure it's dry. Apply the medication for dry and flaky skin while the area is too moist. Apply medication gently and along the direction of the hair. Let the client know if the medication will feel cold or greasy. For powders, wear gloves and perform hand hygiene first and perform wear gloves. Ensure the skin is dry and clean. If you apply the powder near the client's face, instruct the client to turn away, and they should not inhale the powder. Add a light layer of the medication, in this case powder, and depending on the doctor's order, you may need dressing, or the area needing the powder may need dressing. Okay, subcutaneous and injections. This will have to do with your insulins if you're actually trained to give insulin. Make sure the syringe is, so when handling, make sure the syringe is always has a cap on. Be careful not to be pricked by the needle and keep the needle clean and sterile. Administering medication, perform hand hygiene, clean the sites you are going to give the needle, so using alcohol wipe. Pinch the injection site. Insert it in a 45 or 90-degree angle. Avoid moving the syringe around. Redraw the needle at the same angle. Apply gentle pressure on the area with a sterile gauze. And if it's a single dose, dispose of the sharp um, in a yellow bin and make sure the sharps are placed in like a foolproof container. If the needle punches someone, it may spread infection. Rectal stroke suppository handling, you need to make sure that you're wearing gloves. You need to ensure that it's stored properly in the fridge. You need to know, or before the client self-administer the medication, the client needs to go use the toilet. So go open their bowels and do not administer the medication if they have diarrhea or rectal bleeding. How do you administer this? You need to perform hand hygiene. You need to apply lubricants to the medications. You need to make sure the client's in the proper position themselves. You need to use your non-dominant hand to separate the buttocks, and you need to use your dominant hand to insert the suppository 5 centimeters in and maintain the position. The client should maintain that position for 5 to 10 minutes. All right, administering medication through the vagina. Again, gloves should be worn. Ensure that the medication is stored properly, in most cases in the fridge. And before they self-administer, you need to make sure that the client is aware that they need to go to the toilet beforehand. How do you administer it? If the client can't self-administer, you need to perform hand hygiene. You need to apply lubricant on the medication or the medication aid or equipment. You need to properly position the client in bed, so laying on their side and their back. So the client must lie on their back with their legs bent and their feet flat on the bed. So now use your non-dominant hand to separate the labral forward, and also with dominant hand, the client will insert the medication, or the medication should be inserted 8 to 10 centimeters inside. The manufacturer may provide an applicator, and the client may use that if they prefer. When going through administration routes and procedures, remember to abide by the following: the legal requirements. So you must abide by the laws on how to care for clients as you administer medication. Precautions. You must administer, or when administering medication, abide by the standard precautions. Make sure to confirm if you need to enforce additional precautions to prevent inflammation. And your role responsibilities. Do not step outside your role responsibilities by performing tasks that you are not trained or qualified for, or by performing tasks that you're not in your job description. Administer medication according to the rights of medication and other requirements. When discussing the following on how to administer medication, you need to talk about the rights of medication, the written prescription, stroke delegation instructions, stroke care plans, stroke medication chart, and other documents with medication instructions. You need to talk about legislation, code of practice, and organization procedures. The rights of medication. So we have the right patient, the right medication, the right dose, the right route, the right time, the right reason, and the right documentation. So all these rights are very important, and it's very, very important to go through all of them before administering medication. All right, legislation. Disability Service Act in 1986. We have the Aged Care Act in 1997, and we have the Aged Care Quality and Safety Commission Act in 2018. What is duty of care? Duty of care is a legal obligation that requires a support worker to act within their client's best interest. Work health and safety, on the other hand, ensures that the support worker, clients, their family, and other public members are protected from illness, harm that elements in their immediate environment may cause. That doesn't make sense. I'll repeat that one more time. So this these practices ensure that the clients, workers, um, their families, and public members are protected from illness harms that can be found in their immediate environment and might cause harm to them. Um, Codes of practice. Codes of practice or codes of conduct outline various expectations that all support workers must meet. These codes of practice for support workers or professionals include obligation as a support worker, minimum standards for appropriate behaviors, and examples of scenarios, situations that require workers to evaluate their actions. And this can the NDIS Code of Conduct and the Aged Care Voluntary Industry Code of Practice. The following are professional standards. We have the ISO standards, we have the medication safety standards, we have the national standards for disability service, and we also have the aged care quality standards. Understand and respond appropriately to medication orders and documents. Specific documents provide information on what, how, and when to administer medications. In other words, referring to this will help you assist you in checking medications. Specified documents mentioned include the following. So we have the medication order, we have medication instruction, we have prescribed form, and organizational procedures. Consult and confirm actions with authorized professionals. To consult is to seek advice. To confirm would be to check the correctness of the information. You will consult and confirm with someone with specialized or specialist knowledge, which is the delegating health professionals or the authorized practitioner for that client. All right, what have we learned today? We've learned a lot of things. We've learned how to create and identify clients according to the organization's procedure and prepare them for medication administration. We've also learned how to check medication according to organization guidelines and delegation from health professionals, how to accurately explain the administration procedure to the client, how to prioritize or how to check the client for any physical or behavior changes that may occur before administering the medication, and also how to report it to the delegating health professional. We've also learned how to administer medication as delegated within our role responsibilities, and also how to administer medications according to the right of medication, specific requirements from the formed, prescribed, and in accordance with the delegated legislation, organization procedure, professional standards, and prescribers' written instructions when available. What to do next? All right, so before the next class is expected, you complete the e-learning module, chapter 4 and 5, and also complete the knowledge questions, um, 21 to 28. Thank you everyone for listening and have a lovely day. Bye.